Welcome, everyone. Hello.
Hi, everybody.
Hi.
Hello.
Okay, I'm seeing some faces. I love to see the faces. Love to see the faces. All the beautiful faces.
Got to put it on gallery here to see all of them.
Absolutely.
Go ahead and get started, Jenna. It's 5 after.
We may as well. All right. So welcome, everybody. If you're new to us, could you do me a favor and just give me a thumbs up? Whitney, Elvira. Okay, I don't see everybody on their cameras. So we're really excited to welcome some new faces and always happy to see faces of people that we know and have been with us forever. I know that, there's, as we're trying to figure out how we're distinguishing both of the businesses. Chess was started in 2009 by Eric and myself, and we are a health event management company. Our initial focus was on inhibitors, rare bleeding disorders, and women with bleeding disorders. And that still pretty is. It is, truly where our hearts have always lied, given our own family history and our own personal history with bleeding disorders. And then Inspiration was started in 2015. It has a separate board. Here we go. A little bit of music is always good. It has its own separate board, which is composed of Jill Gibbons, Trisha Corbett, and Barb Force. I don't see her on the call tonight. And our charitable campaign chair is Connie Montgomery, who I know is on the call tonight. Inspiration's focus is to provide access to education through travel scholarships, to provide economic hardship funds, especially during this time of COVID, and to provide support and resources to the community. The LadyBugs program has always been a chess program for since 2016, I believe, when Barb turned it over to us to run. And we're really thrilled for her guidance and for her vision for women with bleeding disorders. She's been advocating for women with bleeding disorders since 1998. So we're just honored to be able to kind of pick up that mantle and keep running with it. And for those of you who have been to our LadyBugs program, LadyBugs Forever, and those of you that are new, we welcome you. So thanks for coming tonight. Eric?
If you were on our last call, I think this is when we started doing it with Chris and Joan. We spun a wheel and we gave some gift cards away. And for every session up to now, we have been giving you a valuation to fill out from the previous session. So I have everybody's name who's turned in an evaluation from attending the session last week, which was the kinesio taping with Dr. Z. And we will spin the wheel and we'll give out 2 $25 gift cards to those people. And just a reminder, to piggyback onto that, we'll also send out an eval at the end of this session. We'll put it in the chat box for you to access that way, and we'll also email it to you. So you shouldn't miss it. All right, so let me pull this wheel up. This is a big wheel tonight. We've got, I think, 28 people on it, the biggest yet, perhaps. So the kinesio taping was pretty popular. So if you win tonight, then you might want to go buy a lottery ticket because maybe you're feeling right. All right, so first spin, we'll go. Amber.
Woo!
Not our presenter, Amber, though, I imagine.
No, we have a different Amber.
Okay.
Right. And we will make certain that Amber gets a $25 gift card sent to her.
Okay. And then here is the second chance for everyone else.
All right. Come on, wheel.
Christina B. You know who that is, Janet? Right? Christina B.
Yes.
Yeah.
Excellent.
Okay.
Don't see her on the call, but we'll be certain to get it out to her. So awesome. So you will have an opportunity to win next in 2 weeks, right? Our next one will be in May. And we'll take a little break, but please make certain that you send the evaluations. They really do help us, and they help our speakers in terms of knowing, whether we answered all of your questions, that this was helpful for you, is something that we can offer again. What are the things we can provide? So without further ado, I would like to introduce Amber Federizo. I was just telling her that she has a little bit of celebrity status within the LadyBugs group. I can't tell you how many times I've seen on evaluations on the OBGYN session to say, could you please invite Amber? I'm like, yes, we will definitely invite Amber. So this seemed like a really great time to be able to have her come on. We've already had a couple of sessions for LadyBugs. We did managing monster periods with Dr. Christina Haley and Dr. Maureen Baldwin. And then we did family and birth planning. And we also wanted to make certain that we provided an opportunity to discuss sexual health and intimacy. So Amber was born and raised in the rural reaches of Nevada. She has a passion for reaching those who might otherwise be lost or forgotten. With this has come a form of resilience, which transcends the point that most would give up. You know what? As women who have been searching for diagnoses, you can certainly understand that many of us have not given up. Her passion and candor brings light and hope to otherwise stigmatized populations, such as women with bleeding disorders or sexual health and bleeding disorders. This passion culminated in the recognition of her work in 2018 when she was selected by NHF as the Humanitarian of the Year. Congratulations. In addition to her doctorate, she also holds a master's degree in nursing education. She was one of the first nurse practitioners in the United States to become a principal investigator of several clinical trials. And mostly, she's well known for never taking no for an answer when it involves the care of another. So thank you. Welcome, Amber. I think you're still on mute.
Thank you. And as always, thank you for having me. For sure. I'm going to go ahead and make sure the share screen works and pull this. Okay, there we go. So yes, my name is Amber Federizo. I'm a family nurse practitioner. I do treat patients from birth all the way into death. I do cover the entirety of our state. It's 110,000 small square miles. So we do have to fly to several of our patients or otherwise drive about 10 hours to go see them. So it's been really good for me coming from rural areas to know that there's always going to be access for them. And this is probably one of my most requested presentations. It's probably the one I enjoy doing the most. And it does start from menstruation all the way into sexual intercourse. So I will start with menstruation, and then feel free to interrupt me at any time throughout the presentation to ask questions as we're discussing it, or let Janet know through the chat to go ahead and ask me that way as well. So I do have a conflict of interest statement. As you can see, my conflicts of interest have conflicts of interest. So I do a lot of advisory board stuff for a lot of different manufacturers, and I am on speakers bureaus for several different companies and foundations, but I only do non-branded content, so I don't do anything specific to specific products. And then I do research with HTRS as well as several clinical trial programs. And then I myself have family members with bleeding disorders as well. So menstruation, it's a terrible word. I don't know who created it, maybe because they put men in the front of it. I'm not sure, but it's hard to spell. It's really long. It makes it more difficult to understand, but that's basically what they will call when you have started your period. It goes by many different names. We as women have tried to avoid calling it menstruation, so we call it really cool things like Aunt Flo, or paint the town red, or any of these other. My favorite one has been riding the cotton pony. That has always stayed with me, is probably my favorite one. But where did the term period come from? The term period really came from lunar cycles. So the moon cycle is 28 days in duration. And so there was a point in time when they said, well, how long can I expect to go in between bleeding and bleeding again? And lunar cycles are 28 days. So they said the period of time is 28 days. Now, can you predict your period by the moon? No, it's not reliable. Maybe like a broken watch, it might be right twice a year, but the majority of the time it's not going to be accurate for you at all. But that's where the term actually came from. And then the average age of starting is 12. So most of the individuals we see are anywhere as low as 7 to 8 years old. And then we're really trying to get people started if they haven't by 17, 18. So there is a range. In years past, that age had actually gone down somewhat. So we were fortifying a lot of our milk and meat products with hormones. And we realized, oops, if you give meat and dairy hormones, those hormones are passed on to children, and it actually causes them to develop earlier than we would like for them to. So we did go down in age, and now we're back to an average age of 12. So irregular periods can also persist up until the age of 18. So unfortunately, if a girl starts at 11 and things are heavy 1 month, and then they go 3 to 6 months and they don't have another period, that isn't necessarily problematic, because the body and the pituitary are still forming. And so when you have that response and they're talking to each other, as you get older, as you mature, that response should start to even out. But that can actually persist until a woman has really reached their developmental milestone of being fully mature by the age of 18. And in some cases, menstruation can increase bleeding of other mucosal tissues, such as the nose. So we do have girls who say when they are on their period, they will actually have more episodes of nosebleeds. And the reason for this is that the tissue that is in your nose is the tissue that is also in your uterus. It is also the tissue that is in your vaginal canal. So all of that tissue does respond to estrogen. It does respond to hormones in exactly the same way. So when you're bleeding in one area, it can trigger bleeding in another area. The same processes that result in uterine contractions can affect your intestines as well. So the uterus sits right in front of the intestines. It does irritate it when it becomes irritated. And so your intestines can become irritated, which actually increases the chances of diarrhea during your period. So some girls will be really embarrassed to say that they have bowel movement changes around their period, either before, during, or after. And that's because your uterus is actually affecting your colon and can cause diarrhea. And usually it lasts for a couple of days, but it is kind of disconcerting that some girls were never told, hey, this isn't because you ate something bad or anything and it's coming every month. It's actually because your own body is actually causing this to occur. In 1946, Disney made a film entitled The Story of Menstruation. So, props to Disney. They do some things wrong, some things good, but they were one of the first people to actually kind of put it out there in the media and actually do a story of menstruation. So if you're ever bored and you cannot sleep at night, you can actually go online to YouTube. It is still out there. And you can actually view this, and it's actually pretty good. It is still very relevant, and it is actually it's kept up to date, although it is an older video. So definitely, if you're bored, you can definitely take a look at that. So I always like to address myths. So of course, women do not bleed blue. What I mean by that is most of the major commercials that we see on TV have this idea that you hold a pad out and you dump some blue liquid on there, and it's great if it absorbs all the blue liquid, and you're going to be protected from this magical blue liquid. But women do not bleed blue, and by utilizing blue, you're really stigmatizing the idea that it is supposed to be hidden or embarrassing. I've actually seen more of them as years have gone on use actually red dye and actually get a little closer to what it should actually entail. But yeah, women do not bleed blue. We are not Smurfs. We definitely do not bleed blue. Another myth is that women cannot become pregnant on their period. That is absolutely untrue. People's different cycles can be impacted, and they never know exactly when their ovulation might occur. So just because you're pregnant doesn't mean that the sperm could actually survive in the vaginal canal and then go on to actually impregnate and actually go on to conceive, even though you're on your period. So that's definitely not a guarantee. That's why they call it the rhythm method, and it doesn't really have that good of an accurate in preventing pregnancy. Swimming in the ocean while on your period will cause you to be eaten by sharks. Again, this one is completely inaccurate. Actually, when you are swimming, the pressure of the water compared to the pressure of the vaginal canal actually holds most of your vaginal fluids inside. So even people who are swimming, you know, if you want to use a tampon, you can, but you're actually not going to be able to bleed very much into the water, and definitely not enough that any shark is going to want to find you or be able to come and grab you. Women need to be a certain age to use tampons, also untrue. So any girl of any age who has started menstruating can use a tampon, and we will discuss some of those options a little bit later on. But that's one I encounter a lot is people will ask me, how old do you have to be to use a tampon? And I tell them there is no minimum age. Everything you cook will be a disaster. This comes out of Italy. So there are still families there that do not allow their women to cook while they're on their period. It's one of those that's just been preserved culturally, but of course it really doesn't matter. I mean, I can tell you everything I cook will be a disaster. Doesn't matter when I cook it. So definitely that one is untrue. And one of my favorites is that NASA actually asked Sally Ride if she needed 100 tampons for her 6-day space mission. So these were the country's, you know, eminent engineers, and they had really calculated this all out, except they didn't even bother to ask her whether she would be on her period, near her period, or at all on the space station, nor whether she would really need that many tampons. So it's interesting that, you know, space engineers couldn't really even figure this out either. So that's one of my favorite ones. This is what is actually going on during your period, which is always kind of a mystery. It's a mystery not just to patients and families, but I can tell you it's a mystery to even healthcare professionals. As you have your period in these first few days of bleeding, you will bleed from day 1 all the way down here. It should end by day 6 or 7. And this is all regulated by hormones. So as you're starting to have your period, you can see the hormones coming down and dropping off. And then as your period stops, you get this huge estrogen push. And this estrogen push will start to recreate your lining. And then your estrogen should fall at about the day 14 when you should, in theory, ovulate on time. And then you will get a huge progesterone push. And why is this map, as I call it, so important? Well, it's important because I see a lot of women who are referred from gynecology or go to gynecology and they're just put on any kind of hormone. And there really is no consideration for when in their period the woman is having an issue. So it's important to track your periods and understand, are you having more bleeding during this time, or are you going through this time and then you're already bleeding again at day 14? All of those are very different problems, and they're approached with very different hormone formulations. So if you're put on a hormone that primarily works here, but your problems are over here, you might get all the side effects of the hormone without any of the benefit in your period. So it's really important to know the timing of when it is with your period that you're having the most issue. Oftentimes people will actually have their period and then they won't stop bleeding. And that's because they didn't get the estrogen push. So sometimes they also need that progesterone to be able to maintain the lining right before they have their period. So all of these are important because I see way too many people that are just placed on whatever pill of choice their insurance has decided, or whatever pill of choice their hematologist may be familiar with. But there are a lot of different options with a lot of different formulations. And so I say that it's really important for you to really map out your period for yourself so you know what is normal for you, you know where it is you're having problems if you do start to encounter them. So there are different options for your periods. I always tell people this was the completely ignored options in any kind of health or sexual education, that there are different options because most kids are familiar with maybe tampons or pads, but there are so many more options now than there ever were before. So these on the left-hand side are actually, they're homemade pads. They're actually cotton print and they have different styles. So this is more like, day 3 heavy flow, kind of dark side time. And then this is like, yay, it's day 6 or 7. This is almost over. We are now Wonder Woman. But one of the reasons that my husband actually makes these is that we found that a lot of girls, especially in our women with bleeding disorders clinic, they would come in and they were having a lot of episodes of bacterial vaginosis. And one of the reasons they were having that is when they first came in, they were not on the proper treatment to stop their periods. So they were using commercially available products from the store. And the pads that you get from the store actually have a plastic backing on them, and they don't allow your normal skin to breathe. And so that, combined with a very warm area, actually breeds a lot of yeast. It breeds a lot of bacteria. And unfortunately, it can cause irritation. It can cause issues. And so if you have more of a cotton compound, or you're using these pads, we found that the rates of those types of things decrease substantially. Plus, they can definitely be more comfortable. And then as it applies to tampons, tampons are also not created equally. There are different brands, there are different sizes, there are different ones with lubrication. We always recommend, as I said before, we'll talk about girls just starting out with tampons. We do recommend non-cardboard applicator and lubricated tampons. These actually slide in much more easy. They are easier to insert. They are easier to take out. Plus, a lot of younger girls and a lot of older women who have maybe not had sexual intercourse in some time or never at all, they will have a condition called vaginismus. And what that is, it's when the actual muscles of the vaginal canal, they will actually feel something and they will constrict down around it. And so anyone who has ever had pain with the insertion of a tampon, that is what is happening, because a lot of people are like, whoa, if I can have a penis in here, why can't I have a tampon? And that's actually what's going on. Your body isn't always ready for you to switch out a tampon, as it may be for sexual intercourse. So that's definitely something that can occur. There are people who cannot overcome their vaginismus over time, and so tampons are not always an option for them. But keep that in mind, that you really want to try one that's not applicator based if that's a problem, and kind of provide girls who are just starting out with different options and different sizes, because it is really much more comfortable that way. And then this bottom area here, actually these have come out more in recent years. These are what's called period panties. So the reason I don't like period panties is because they are very expensive, and you can actually make them on your own, and they are much more cheaper to make. So all they really are different in terms of other panties is that they have kind of more of an absorbent layer to them. And yeah, you kind of have to get to that idea of, well, is my period blood just going to sit there? And that is true. I mean, you don't really want to wear them, for a whole day. So that you got to kind of have to get to that idea that it's more for protection. I tell people, if they're going to use them with a pad so that you know that you're never going to leak through. But I also tell people, if you're leaking through, maybe your treatment is not the greatest, because one of the biggest things that I'm told by women with bleeding disorders a lot is that none of these products work for them because they have a bleeding disorder. And I always have to say, if none of these products are adequately protecting you, you are not adequately treated. So every product that is on the market to protect clothing and everything should work for you. And if it's not, your treatment is not working. So definitely you can make these period panties on your own. There's actually different designs online. They're actually pretty easy to make. But a lot of people don't like them because they don't really like the idea of just wearing like period panties all day. And then we have the newer options that people are now becoming more familiar with as well, which are the menstrual cups. So as you can see, there are many different designs. There are many different sizes. And some of them, I will actually try to switch my camera. Let's see if this actually works. Sometimes it does, and sometimes it hates me. Let's see here. Oops. Okay, it's actually going to work today. So this is actually what the pad looks like in real life. It actually has Velcro on the corner, and they just Velcro to the underwear. And like I said, you can make them in different flannel, cotton, different absorbencies. You can custom make them to your period. Again, you can buy them online, but I find that they're exorbitantly expensive online. So if you just kind of want to get crafty, I mean, I'm not good at sewing, but I can usually help my husband get these sewn pretty well. These are kind of what these look like. And then in terms of cups, these are little smaller Diva cups. And these ones are actually kind of nice because on the side of them, you can see, well, you can't see as well. This presentation is much better in person, but I'm going to try to get the markings on them. This one has markings on the side, and it can actually measure how much menstrual loss you have when you empty it. So if you have one of those hematologists that wants you to like prove how much blood you're losing and you need to record it for any reason, you can actually record it with the side of these and actually kind of bring that information in. I always tell people if there's a hematologist or a gynecologist is not listening to you, just bag up all your hygiene products and be like, hey, do you really want to see these? Most of them are going to say no, but I don't find that, you know, women are not lying about how much bleeding they have, but it's one of the things that I guess providers just don't believe the most in. This one's more of a silicone, so it's much more softer, much more pliable, and it's actually reusable, so this can be washed. And a lot of people will say, well, how do you take this out in a public restroom? It does take time to handle it, but once you do, it's actually really easy to use and rinse. And I actually tell people too, we have to get used to supporting each other as women. So if you saw someone cleaning this out where the baby changing station is, someone might give them glares or looks, but in reality, they shouldn't, because it should just be a normal part of what we do and not kind of stigmatize each other. There are also other ones that look like this. These ones I would really only recommend for women who've had babies already, because this stronger rim, people can actually feel this, and it kind of feels like they have to pee a lot, so they don't really like this one as much, but it does work and it is disposable. So if you don't want to wash it out, you don't want to have this guy in a purse, in a bag somewhere after you're done using it, you could actually just throw these ones away. And then what they do look like inside is, I'll try to get this guy in there. So how these are put in, I don't know if I'm going to be able to get, yeah, okay, is that they're just folded over and then they're just inserted. And once they're inserted, they actually sit right here, right against the cervix. So it just fills up with blood, and then you can actually just end up just reaching in and pulling that guy out. And it does get easier with time, but a lot of people really find them comfortable. You can wear them longer than you can with a period, and there's less risk for toxic shock syndrome, so long as you don't leave them in more than a day. But I wouldn't recommend anyone leave anything in longer than a day. So those are some different options. I know that for a lot of women that I talk to, they were never given any of those options. So it's just something, if you do have girls who are at the age of menstruation or just before, to start having those conversations with them about what their options are and what that might look like. Let me see if I can go back. Okay. And the sponge on the bottom right-hand corner, this has kind of a bad story to it. A long time ago, people would say, let's go natural and let's go and do some things that, you know, I want to be all natural. They actually were online and they searched up sea sponge. And so people were using natural sea sponges to actually control their periods. So, of course, natural sea sponges, they are in the ocean. They drift around with everything else that is in the ocean. And so people were actually using them. And there was a horrible outbreak in Southern California of pelvic inflammatory disease. Some people became infertile because it was claimed online that because they were all natural, there wouldn't be any problem. But of course, I tell people the bubonic plague was also natural, also problematic. So if you do want to use a sponge for menstrual control, please only use these synthetic guys. This has a hole in it for your finger so you can pull it out, but only use synthetic sponges. The one really nice thing about these sponges is that you can actually wear them while you're having sexual intercourse, and the partner really does not feel it. And so a lot of people really like these sponges because they don't have to remove them, makes things a little less messy. And so people really enjoy them. But like I said, be sure it is not a natural sea sponge from the actual sea. please be sure it is actually a synthetic one. We're going to go over some different treatment modalities. This is the hierarchy that I use in my practice. I always start with Lysita and Amicar first. Both of these are antifibrinolytics. So they slow your body's ability to slow down the breakdown of clots that have formed. But if you're not able to build a clot to begin with, it will not help you. So a lot of women I see say that they failed Amicar and they failed Lysita, but really what we failed to do was actually build up a clot that could become stabilized. And usually once we're able to do that, then Lysita and Amicar become workable again. So I tell people kind of we'll work through a different plan and then we'll go back to trying Lysita and Amicar in addition to that. Of course, stepping up from that, we do use stymate or DDAVP. At least we did until the recall, and we really do not anticipate this being back on the market until 2024. So if you are using stymate and you haven't been notified, it was globally recalled because the devices that were used to spray are actually providing too much drug. And so there is a risk of overdose. A lot of people had commented that they have had more side effects in these last year, but they were kind of not necessarily ignored, but people thought, well, those are just normal side effects of stymate. And unfortunately, it really was because women and men alike who were taking it actually were getting much higher doses than they should have been getting. So stepping up from DDAVP and stymate is factor. So a lot of people ask me, why do you consider factor before you consider an IUD or hormones? And I always tell people, well, I'm dealing with bleeding disorders, and factor was developed for bleeding disorders specifically to replace what is missing. So I'm not dealing with any other side effects. I'm not dealing with any other things. I would actually use it before stymate, except that stymate's really easy to use in the nose. So if it works great. If it doesn't, then of course I move on from there. But with factor, you're replacing exactly what is missing. You're not going about it in any other direction. You're not indirectly trying to solve a problem by going through it in any other direction. Are IUDs great? Absolutely. IUDs are great. I love them. They work well for the people who they work well in. The problem with IUDs is they don't necessarily address the other bleeding that females are likely to encounter, such as joint bleeding. Your IUD is not going to help you with joint bleeding. Any of the other areas, such as nosebleeds, your IUD is not going to help you in those areas. So it's very specific to one side of the body. But if that site is really your primary site of bleeding, then of course I would recommend using it. And then hormones. So I am well known for not using the term birth control. So any of the times that I'm talking about the pill or any of the other avenues, I call them hormones, and I call them hormones for a reason. A lot of times when you use the term birth control, people already have an idea of what its intended use is, and we're not using it for that modality. We are using it to treat women with bleeding disorders. We're using it to increase their factor activity levels so that they can have a normal life. We are not using it primarily to prevent anyone from becoming pregnant. There are many medications that can cause miscarriages and cause abortions, and we don't call them birth control. We call them chemotherapy, and we call them other things that can end up having an abortion or any other issues. And so hormones really kind of helps guide us, and there's too many politics around the term birth control. So we really try to focus on calling them just hormones. So of course, there are different formulations. There are different names. There's over 150 or so different variations that can be purchased. And that's also a problem too, because oftentimes providers will be trained during a certain time where only certain pills existed, and that's what they're familiar with, and that's probably what you're going to get. They may not be as well versed on newer brands or even older brands that might work well. And so that's a problem. You really need to have a gynecologist who is really going to sit down with you and explain to you the hormone content and why the hormone content matters. Too many times I've seen people say, well, I'm just on the pill, but they don't know the name and they're not sure of the hormone content that's in it, and providers as well. They're not familiar with the content of the pills, or that there's a difference, or that there are different risks with different types of pills. So I think it's something we need to educate women about in terms of pill use. Mr. T, our friend IUD, props to Bayer. They did probably the best marketing for IUDs. And so most people are familiar with Mirena and they think the Mirena is the only IUD in addition to the copper IUD that's perhaps out there. But that is also not true. There's also Liletta, Kyleena, and Skyla. So these other IUDs, the difference is some of them are smaller than the Mirena and some of them have a lower hormone content in them. So Skyla has a lower hormone content than the Mirena, and the Kyleena and Liletta are actually smaller in size than the Mirena. So if you fail the Mirena, there are different options for you that might work better for women who are adolescents and this is their first time encountering an IUD or we're considering an IUD. I actually prefer the Liletta because we seem to have lower rates of expulsion or having it fall out in women with bleeding disorders of a younger age. So Liletta is our preference in our younger girls and Mirena is our preference in our older adult women. And it does sit in the uterus just like this. It is a T-shaped device. And these two arms actually prevent the uterine lining from building up. So what often happens for some who are very lucky is that because the uterine lining does not actually build up, you cannot actually have a period. So what happens is they might have spotting every month by some tiny degree of buildup, but the most times it's not able to build up at all. The problem with IUDs that we see in our practice a lot is that proper education is not provided with them. You can expect that for the first 3 months, you may actually bleed more as the T-shaped uterine device actually starts shedding this lining more and more. So a lot of people will have these placed, they will bleed more and they will think, oh my God, this has failed. And that's not true. It's actually kind of doing what it's supposed to do. Now, if you continue to have cramps and problems beyond the 3 to 6 month mark, then yeah, the uterine device is probably not for you. But unfortunately, not a lot of women are educated that those first 3 months with the IUD can be more increase in bleeding as it kind of reestablishes how much uterine lining it will allow to actually build up. The other problem I see with IUD devices is that oftentimes they're inserted without any pain control. This to me is absurd. I mean, no one would ever tell men, we're just going to shove this up your penis and you're just supposed to grin and bear it. This can be quite painful for people to have this pushed through their cervix. And so for our clinic, we write orders for what's called supracervical blocking, where your cervix is actually injected and numbed. And so this actually is numbed before we go in there, or we will have the cervix actually softened. We only use one gynecologist that we trust that does all of these procedures to make this a much more comfortable insertion, because if not, this can be so traumatic that women remember it forever and they will never try another IUD ever again once the time is up for it to be replaced. And that's really problematic because especially in these kind of procedure-driven things, we need to take the time. We need to make sure people are comfortable so that they have access to these devices that can make, living their life to the fullest possible instead of just pushing these in and hoping for the best. So if you ever have or know someone who's considering an IUD, please make sure they talk to them about cervical blocking and pain relief. It is one of the few times we will advise women to use non-steroidal anti-inflammatories for a couple of days just to reduce the cramping that can occur. And this is usually my slide where I'll transition into more of the mature content. And one comment I wanted to make before we go into this one is that in our practice as well, we do use non-steroidal anti-inflammatories to control periods as a method as well. So we have found that for the first couple of days of the period, if we use around the clock non-steroidal anti-inflammatories, ibuprofen, those types of things, it does affect prostaglandin release and it can actually reduce the amount of blood flow women have with their periods. So I know it's counterintuitive that women with bleeding disorders not use non-steroidal anti-inflammatories because of the increased risk of bleeding. But paradoxically, in this manner, we actually do use it with periods to actually reduce the flow. And sometimes this is more effective than even Lysita and Amicar. It's just different depending on the individual that we're using it with. So we have different methods we kind of pursue before going to the next step and the next step up. So one of the things I teach a lot, not just here with different foundations, but also internationally, is about the hymen, because it is kind of this mysterious piece of tissue that people talk about, but they don't really understand. So there are actually different types of hymens. So the first hymen you see is what people typically think of a hymen, where you have this extra tissue right here. And then you could actually have a different type of hymen, though. You can have one where it's got 2 different holes. You can have one that has multiple different holes. And then, of course, you have what we call paracentroides, which is basically when the hymen has ripped after sexual activity. The only problem with the hymen is you can get the 4th one from sexual intercourse, but you can also get it from riding your bike. So if you're 5 years old in a third world country and you're riding your bike and your hymen, a very fragile piece of tissue, rips, and they do any kind of purity check, they may assume that as she's older and as she's aged, that she is impure for whatever reason. And women in other countries are still faced with the possibility of death if they are not considered pure. So this is one of the reasons this kind of education is still in these types of presentations. In the United States, there are pockets where this is still a concern, but primarily third world countries where we do these presentations. I've even done this in the Philippines to provide some education because there are very conservative pockets there as well. So it's one of those things that your hymen can literally be broken by literally anything. It's really not a valuable indication of purity or integrity at all. And so one of the pictures we're more familiar with as women is kind of this uterine example. Most oftentimes you'll see memes that have made it into devil horns or devils, but at its basic premise, this is your uterus. This is your ovaries on each side, and you have follicles or eggs that will actually mature. They will fall out of your ovary and they will come into these little finger-like projections and then make this whole journey all the way into the uterus until it will actually try to implant. Now, if it is not, if there's no conception, this egg will actually just fall into the tissue and it will actually come out with a regular period. Most of the time, this process works pretty well, but there are women who suffer from conditions such as polycystic ovarian syndrome or hemorrhagic cysts. And what is happening for them is that these follicles in these ovaries are actually starting to rupture at different rates. And the different rate of rupture can offset the entire balance. And so you can have bleeding at the wrong time because your uterus and your body become confused as to when there's an actually ovulation or when there's actually an egg that is ready to be conceived. And then, of course, the cervix here. Most people or most gynecologists, most hematologists that I've ever seen present, they'll kind of present the uterus, but we'll kind of ignore the vaginal canal. But this is the vagina that leads in. So this is the canal leading into the cervix. And then, of course, on the other side, everything is in there. So one of the things I tell women that is really important is to know where the bleeding is coming from. I have way too many women who get tossed back and forth between their hematologist and their gynecologist. And their gynecologist is blaming their bleeding disorder. And their hematologist is blaming the fact that they are a woman and saying it's their gynecologist problem. Well, I've treated too many women who have uterine bleeding, and that is the gynecologist problem. But I've also treated women with vaginal bleeding, and that is a hematology problem. So if you have bleeding that's here, this is a different problem than if you have bleeding here. Sometimes it's really hard to tell where the blood is coming from, so you have to time it. I have women who will know that a day or two after they've had sexual intercourse, for whatever reason, they will start bleeding again. And women intuitively, whenever we're bleeding, we tend to think, oh my God, my period is here. But it isn't oftentimes your period. It is actually some of the damage that occurs in your vaginal canal can actually present as vaginal bleeding. And so that's a really important, especially women who are having bleeding of unknown origin, or they're using hormones and it's not working, then obviously they really need to have a pelvic exam when they're bleeding to determine where the bleeding is actually coming from. Because like I said, I've seen too many people put on very, very high dose hormones to try to control vaginal bleeding, and instead they're just miserable on their hormones. So this is a very, very angry cervix. So anytime there's any kind of bacterial infection, the cervix can become very inflamed. In women with bleeding disorders, this is really problematic because, as you can tell, it's very vascular, has a lot of blood flow to it. So anytime the cervix is unhappy, it can start to bleed on its own. So some women will say, I'm having sexual intercourse and they'll have this sudden pain, or a couple days after intercourse or even hours, they'll have this sudden sharp pain. And oftentimes when it's deep inside like that, it's because the cervix has actually been hit by the tip of the penis, and it actually creates a bruise at the cervix. And that bruise can take weeks to heal. It can take months to heal. And so sometimes, unfortunately, when this kind of sexual intercourse injury has occurred, what'll happen is the repeat effects of having sexual intercourse again and again will actually cause the hematoma to become bigger and bigger and take longer and longer to heal. And often what'll happen is the woman will stop having sex and kind of say, well, it's due to my period. And then there can be relationship issues because of that. And that's really because we're not allowing the cervix to be able to heal and actually knowing kind of what's going on. But again, it's also a conversation with your gynecologist to be really close with them in terms of really trying to find out what is going on with my cervix. Why am I having this pain? Because pain with intercourse, the underlying reason has to be found. Of course, bleeding with intercourse, same thing. The underlying reason has to be found. I do have a male version of this program that I do that was actually born out of the fact that we had an adolescent male who was admitted to the hospital because he couldn't pee, hadn't peed in a day and a half, and his bladder was completely overfilled. And we found a blood clot in his urethra. And we were trying to determine why there was a blood clot, what happened, denied trauma. And he really wasn't as familiar with the ER staff, so he didn't really want to talk about it. But until we got there, we had that conversation with him, were you masturbating? And he was like, yeah, I was masturbating for over an hour. And just that trauma alone in someone with a severe bleeding disorder is enough to trigger bleeding on the inside. And so that's a conversation that sometimes you have to tell people that you might have to infuse before you try to do any sexual activity, just like you would have to infuse before you do a sports activity or before you do anything that could cause trauma. This is the same thing. And it's very interesting. We're very open about talking to everyone about infusing and taking care of themselves before sports activities, but we don't talk about it as much sometimes with sexual activity. We just sort of tell people to suffer in silence. And if you ever have any issues with sex, there's something wrong with you, but that's not the case. A lot of these injuries are unreported. I can tell you when I first started in the clinic, sexual health was never discussed. We had a primarily male physician group, and they never talked about sex. They never talked about what could happen during sex. And so it was really enlightening. The more we talked about it with women, with men, the more people opened up, and we were able to help them in ways that we never thought we would as a hematology clinic, as an HTC. And then this right-hand picture is actually what's called an incompetent cervix. So a lot of women who had been referred to me in third trimester for incompetent cervix, and they have a bleeding disorder, they would have their cervix banded. And unfortunately, before we started studying this, what we saw was that they would actually have a premature delivery. And we were trying to figure out, how can we help prevent a premature delivery? Of course, it's an incompetent cervix, but we found that if we gave them factor while this was here, it was more likely to be able to hold stable than it would if we didn't. And so that's one of the things to keep in mind, is that any kind of trauma that we are doing or any kind of healing we want to happen has a really hard time if we don't have enough clotting factor available to actually do it. So of course, protected sex is probably the one thing that is in politics. It's the one thing in junior high that everyone is kind of taught, but depending on where you are, depending on what state you are born, really determines the level of education that you have access to. So unfortunately, a lot of those programs are not really in depth. So I'm actually going to try again to stop my thing and go to camera. Sorry. Like I said, this is a great one for being in person. Online, it's a little harder. Okay. All right. So Yeah, I know I'm probably a lot of the commentary that occurs with a lot of this session is probably because I'm very, very anatomically correct. So I don't know if you're ever going to ever see a hematologist again with a dildo, but yes, you will see it here because I always tell people you can't really begin to explain to them if you're using a banana or if you're using something, it's not the same. I mean, we have to get to the point where it's not awkward. It's that kind of content and it's the anatomy that we need to learn on. And I wish that boys were actually taught anatomically correct because there is no shame. People shouldn't be like so queasy around it. We just kind of have to get used to it. Otherwise, we're doing our boys a disservice. We're doing our families a disservice because if we can't really have that conversation, then we can't really expect them to have that conversation. So one of the things that we go over with in our adolescent series at our clinic is actually the right way to put on a condom, because when boys are taught with bananas or they are taught with any other shape, they actually learn how to put a condom on wrong. So I will always have boys who come into the program who we will give them a condom and we will tell them, show us how you think this will be put on. And they will just kind of like go like this. And they will be like, oh yeah, I think we need to get it on all the way. And they will do it just like that. Now, as you can see, there's a huge problem with doing it that way. What will end up happening is there is no tip to this at all. So this is how boys are actually taught how to put on a condom, because on a banana, it will go to that. And if the educator is not good about teaching that this tip actually has to be at the top, they are ensuring that the condom is not going to work. So I hear oftentimes on TV or whatever, they'll say, oh, the condom broke and we had an accidental pregnancy. I can tell you that the rate of condom breakage is exceedingly low. These things are tested from a manufacturer's standpoint. Now, if you're using an expired condom, then yeah, maybe it did break, which is something you need to go through with your daughters, or even take a look at those condoms and look at the expiration on the back. Make sure they haven't been in a pocket for years and years and years, because they do have an expiration. This expiration on this one actually is still good. So we have until 2023. But this is one of the primary reasons I see for condom failure, is that this is actually not intact. And when this is not intact, once the male will ejaculate, it will not actually collect here. It will actually come out, travel all the way down the side, and it will actually leave the condom. And that actually completely does away with any of the benefits of using the condom in the first place, because you are now exposed to STDs. You are now exposed to pregnancy. And I'm not saying that condoms don't break. I know that they do. Like I said, if you're using expired ones, and it's a 1 in a million chance. But the majority of times when someone said, the condom broke or any other thing, or they still became pregnant, it's more likely because they were never actually taught how to put a condom on in the first place. And I find that incredibly sad, because we're supposed to be providing education about our bodies, but we can't even use the right anatomy in high schools, or even less than high school and junior high. And so that's kind of where we start with our guys, in terms of being sure that they really know how to put this on. But we also do this for our girls, because boys are sometimes separated in their sexual education class from the girls, and the girls don't get to see that. And so how, as a girl, are you supposed to know when they're putting a condom on that they did it correct, if no one was ever willing to show you what that was supposed to look like? And so those are critical pieces for sex education for people who have not seen it. And then, as much as I know, we don't want to believe, 11 to 13-year-olds are doing different things. They are. Many of them are learning their body. They're learning how to masturbate. And so one of the things that we talk about from the age of 10 in our clinic is actually the use of these guys. So these guys are actually finger condoms. Why would we use them, you would say? Well, these finger condoms actually go all the way on the finger. And what they do is actually create a lubricated soft surface that actually covers the nail. So we have had young girls who have come in with blood, quote unquote, in their urine. And when we talk to them, they actually were fingering themselves, but their nails and things will actually cut the vaginal canal. It doesn't usually cause pain initially, but it can cause spotting and bleeding in girls. And so we talked to them about the family about possibly talking about these and using these because these reduce the risk of bleeding and injury. And this is across any age group if people want to use them because they have longer fingernails or sharper fingernails. It's definitely more of a protective mechanism, but it needs to be an option for anyone to try to use. And then my biggest educational push for condoms in general is absolutely the knowledge with sexual health that these exist. So if you've never seen one of these, you are really done an injustice by your sexual education program. This is what is called a female condom. It has a ring at the bottom and then it has an opening here. So they are, let me insert it into the pelvis so you know what this ends up looking like. So these end up sitting on the outside kind of just like this. And the camera doesn't really do it justice, but so people are asking me all the time, why are you such a proponent of using female condoms instead of male condoms? And I tell them, recently, if you've kept up with some of the news, there's a term called stealthing, and that is where men of any age, sometimes Tinder dates, sometimes colleges, this information runs like wildfire. So if you have college age girls, please be sure that they use female condoms. The reason I say this is because stealthing involves when the male is having intercourse, they will actually pull out, they will pull their condom off, and they will resume having sexual intercourse without letting the female know that they have removed the condom. These sexual assaults are not reported very often because a lot of women will say, I agreed to have sex with him. I agreed everything was consensual, and then he took the condom off. Who is going to believe me now that this is rape? And so, unfortunately, a lot of these crimes go completely undocumented. And the reason I don't like male condoms is because women cannot tell actually when they're on or when they are off with any kind of sort of validity. The difference with a female condom is that if the male tries to pull this out, the woman will feel this ring exit. There is no way to remove this condom without the female knowing. On the positive side as well, a lot of the male partners will actually say that these are far more comfortable because they're not constrictive around the penis. They actually allow the sensation. And people say, don't they just get pushed in? But they don't. They actually sit here and they do what they're supposed to do, and then they're just completely removed. But my reasoning for encouraging women especially to understand and know female condoms is so that they are never sexually assaulted in a way that they never thought that they would be, because female condoms prevent that 100%. And that puts the power back in their hand that the man can't say, well, I don't have any condoms, because the females will always have condoms. My biggest issue with female condoms right now, however, is that they are much more costly than male condoms. It is not fair. It is one of the kind of things that is different between the genders. And so as these become more commonplace, as we provide more education, we hope that more females will use them. They will be produced more often, and then the price will actually come down. We provide these free of charge in our clinic, in our bathrooms. So the next time you're at your HTC, see if they might consider doing the same, just so that people have access to different options. I'm well known actually in the community for advocating for these as well, because I ran out of these for a presentation that I did, and I went to go get them from a local porn store because it's the fastest way to get them. It's faster than Amazon in Las Vegas. So my husband laughed at me because he was with me to come get these, and I was upset because they didn't actually have any in stock at that particular store. And I had a very long conversation that they needed to become educated and actually provide this as an option. And so, yeah, my husband made fun of me because he's like, I think you're the only person in the United States who's ever been angry in a porn store. So yeah, I had to go through that. But now they carry them, and I'm very proud of that store for opening that option and those access for women. So those are things to consider with sexual health. And then, of course, dental dams. I'm sure that many of us were told about dental dams, or we were told about protective films or anything, and we were never really showed what they look like. So this is actually what dental dams look like. They are a latex piece, and they are sometimes flavored. This one I think is blueberry, but the premise is that it's a barrier between you and wherever you're going to put this. So you can use this in a similar fashion as a condom. So you can put these over any area that you want a barrier between your mouth and anything else, or you can put them on a pelvis. Sorry, everything is sticking together. There we go. Okay. Or you can put them on any area that you want protection between your mouth and the other area. A lot of adolescents that I talk to, when they think of these, they actually tell me that they go into their parents' kitchen, they go and get Ziploc bags, and I tell them, or saran wrap, and I tell them that's a terrible idea because saran wrap is not waterproof. It actually does have some breathability so that the food can, not be completely cut off from the air. So as much as you think it's a barrier, saran wrap is not a barrier. Things can still cross through it. Sexually transmitted diseases can cross through it. And then Ziploc bags actually have a creased side on the edge, which can actually become very sharp. And so you actually do risk having a vaginal laceration when you are using saran wrap. So never substitute anything for any of these products. I tell people just to have that conversation with their friends or family, anyone who's of age, who's looking for protection, to look at the expiration date, look at what it is you're using, and always have more than one. Always be prepared so that you can be completely protected. And this doesn't matter your age. I'm still talking to women who are older in their 60s and 70s. They think, well, I'm after menopause. There's no reason I need to protect myself. But oftentimes HPV viruses that cause cervical cancer, those things can still be spread. Chlamydia, gonorrhea, all of those things still exist in your 70s, in your 80s. You definitely don't want those types of things. So I do tell people this is an educational presentation. Doesn't matter your age, just matters on whether or not you've considered sexual activity or whether you're preparing to have sexual activity. When I first gave this presentation in Fort Lauderdale, I was approached by a family of a teenager who had actually made a pact with her friends who had bleeding disorders that they wouldn't have sex until they were 21. And their reasoning was really heartbreaking because they were convinced that they would bleed out with their first sexual intercourse because they had been told there should be bleeding that will happen. And they were terrified because their bleeding disorder had been so severe that if they tried to have sex, they were going to have bleeding. And so this 15-year-old that I was brought to me to ask questions, she was considering not having sex at all, even beyond that age, because she was terrified. She literally believed that she was going to bleed and die because of sex. And so fortunately, her mom had brought her to the presentation, and I spoke with the mom and the girl about using what's called vaginal dilators. And then when I go back to the presentation, I'll show you what that looks like, but I do have a set here. So vaginal dilators are used for women who have either not had sex or have not had sex in a while. So sometimes people in their 60s, they go through a medical event, they have not had sex in quite some time. The muscles will actually atrophy or get smaller. And so sex can become painful, even though it was never previously painful. And so oftentimes you will have to begin again. As much as that seems odd to have physical therapy of the vagina, it's essentially what it is. So these dilators are actually start in a smaller size. And then we tell women to use these to masturbate with these sizes for 2 weeks until they can get up to the next size. So these sizes will then clip in. So each of these go up into the size until they get to the size of their partner. So these just clip in. So what these can do is they can actually stretch the muscles with comfort because you're not using this size to start with. You're actually using a much, much more controllable size. And so a lot of women are actually able to start having sex again comfortably by going through basically physical therapy. And it's unfortunate because a lot of women that I treat in their 60s and 70s were basically dismissed by their gynecologists, and they were told that they could go on hormone replacement and they shouldn't have pain with intercourse, but it's just due to your aging and there's nothing you can do about it. And that is absolutely not true. I also tell adolescents it is absolutely not true that you should have bleeding the first time that you have sex. I know as a society, we have decided somewhere along the road that that was acceptable. But if you are going slow, if you are using lubrication and you are allowing time and foreplay, there really should not be any bleeding. Bleeding is a result of too fast, too traumatic. And I don't want anyone's first time or any time to be traumatic or painful. Sex is not supposed to be painful. It is supposed to be enjoyable. It is very human nature. Everybody generally, there's a few that choose for other reasons to potentially not have sex. But other than that, it is very human endeavor. And so our goal is always to ensure that people are safe, they are comfortable, and that they get medical advice that is actually safe and applicable to their condition, instead of just using the excuse, well, you're too young to have this information, or you're too old, you're not having sex. That's not true. People will have sex well into their 70s and 80s. Usually when it becomes more of a hip problem is when I usually say, okay, we're going to have to do some different positions because you're causing too much hip pain. So we're going to have to talk about who's on top, who's on the side, different positions, different comfort. And oftentimes women are sent to physical therapists for their knees and their joints, but they're not sent to physical therapists for urinary incontinence or pain with sexual intercourse. And there are actually board certified physical therapists who work in pelvic floor training and vaginal exercises. There are actually devices that we supply our patients with, pelvic floor strengthening. So there's a lot of different things you can do. There are a lot of different avenues that can be pursued. Like I said, the biggest thing that I find, unfortunately, is that people are never informed. So they don't have all the information they use. And unfortunately, when you go on the internet has terrible advice, and it tells people to do things that actually will not end up working at all. So that's always important to share, that even though we're protecting against usually this guy, we're actually protecting women and men from having a terrible experience that will carry with them the rest of their lives. There's a lot of women who have bad stories about their first time, and that's just not the way it's supposed to be. Another element that I had discussed earlier is that not all bleeding is menstrual loss. So not all bleeding is coming from your uterus. Sometimes that bleeding is coming from your vaginal canal. So some women will say that they will just kind of spot 1 or 2 days. It didn't feel like their period. They don't recall whether or not they had sex the day or two before. So it might not have been from that. But oftentimes what you will get is these tiny little tears. And this tissue is so fragile that you can get this tear just from wiping. So yeah, we went through the pandemic and the quality of toilet paper really went downhill. So if you didn't have a bidet, you might have experienced Sam's Club toilet paper. And that's pretty much like paper towels. So that kind of toilet paper can actually tear the little linings here when you use it. And it can actually cause bleeding. And it's not right away, it's delayed. So hours or days later, you can have spotting and you're like, where the hell did that come from? And that's usually what happened. But it can also happen with sexual intercourse. So with sexual intercourse, you don't want to rush things, because if you don't give your vaginal canal time to expand, or you don't give your vaginal canal that ability to actually lubricate itself, it will actually tear. It's similar to when you're having a baby and you're pushing it out. If you don't have enough time, it will just tear open and go down all the way. These little tears usually don't go that far in sexual intercourse, but they can take forever to heal. A lot of women I talk to, they will tell me that they don't get bleeding, but every now and then after they've had sex, they will go and they will pee and they will get burning. And they will say, well, where is that coming from? And that's because urine has gotten into this tear and actually will cause that sensation. Usually these tears heal really fast. Your mucous membranes do heal really quick, but that's also an avenue. Also, we do recommend always going to the bathroom after you've had sex so that you can clear your urethra of anything that may have been pushed into it. If you don't, you can run the risk of getting a urinary tract infection. And as you age as a female, it is much, much easier to have that occur. So always pee after sex, even if you feel like you don't want to, even if you're super tired and it's 1 o'clock in the morning, definitely go up and go pee. You'll save yourself from having to do an antibiotic stint. This is actually a picture of a vaginal tear. So this is obviously much worse. These vaginal tears are in the wall, and this actually goes all the way through the vaginal wall to the back end. And you can actually, if you were to stick a Q-tip in it, you could touch the intestine on the other side. These tears are very problematic. A lot of people think, well, these tears are more associated with sexual assault, and that is true. But these vaginal lacerations can also occur in women who have had a rushed intercourse. So it can also occur consensually. A lot of women suffer with these kinds of tears for far too long because they're put on hormones and they're told, well, this is your uterine bleeding. Let's put you on some more hormones. And it just keeps bleeding and bleeding and bleeding and bleeding. And no one has taken a look at the vaginal wall to be able to see that it was torn. So normally they're not this severe. I use this one more as that visual, like, hey, it can be this bad. This one would require sutures, but oftentimes the littler ones will bleed and bleed and bleed and bleed for weeks. And what we use at our center is tranexamic acid douche or Amicar douche. So the Amicar and the Lysita that you're familiar with, we compound it into a douche and we use it to reduce the bleeding and actually heal these sites up. So that's why we say it's really important to know where your bleeding is coming from, because hormones are not going to help this. This is not, it'll kind of help get the bleeding stopped, but it's not really going to do anything topically. We had a woman in her 3rd trimester who had had sex and she lacerated her cervix, had quite a bit of bleeding, and we actually ended up doing vaginal packing with tranexamic acid gauze and left it in for 24 hours to get it stopped. So sometimes these things do come up, but I can tell you most of the time, these are labeled as antepartum hemorrhage, postpartum hemorrhage, and they don't really take a look at what's going on. So again, cervical lacerations and bruising of the cervix are probably 2 of the things that are underreported in medical history. They're definitely go unseen, they go undiagnosed, which also means they go untreated. Again, causes include rushed intercourse. So if cookies are comfortable, that's fine. That's great. They may not always be that way. Try not to do that because you're going to increase your risk for bleeding as a female with a bleeding disorder. It doesn't allow for vaginal lengthening. Vigorous intercourse can also cause that to happen. And size and compatibility. We hear in the media, bigger is better and all of that. That is absolutely not true. Size and compatibility can be so painful for the female that it can cause an insurmountable amount of issues if we're not talking about different positions, different avenues that can be used, because not every female is going to be comfortable with a larger size. It's just not true. Larger sizes, this is the one time where bigger is not better. It's just not that true in this situation. I always tell people too, adequate foreplay is a must, but I also recommend lubrication. Unfortunately, lubrication for women has been relegated to like, oh yeah, that's the stuff you use when you're older. Like, I don't need that, I'm younger. But I tell people, it doesn't matter. If you're younger, I assure you it will improve things. You'll actually be grateful for it. So I always tell all of my women to use lubrication every time if they can. This particular lubrication that you see in this picture is water-based. And why do I prefer water-based? Because if you use glycerin-based lubrication, it gets tacky, it gets sticky. And then for women who have other conditions, such as diabetes, they might set themselves up for yeast infections if they're using lubricants that are glycerin-based. So you definitely want to use water-based because it's just going to absorb into your tissue. You don't have to worry about washing it out or anything like that. Water-based is definitely better. Is it more expensive? Yeah, a little bit, but we also use water-based lubricants in our clinic to treat epistaxis. So we do it to prevent the tissues from getting dried out, which can cause nosebleeds. And we tell women that we would give them this bottle and then we would relabel it so that the kids think it's like for your nose. So they don't see this picture on the side of it, obviously. But again, like I said before, these tissues are the same. You can moisturize them the same. So if you're using, we used to tell people use Vaseline. So we used to, as hematologists, we would say, use Vaseline. But there was a lot of studies that were done about petroleum-based Vaseline and not necessarily it being a good thing to even accidentally inhale. And it doesn't absorb, so it's really thick. A lot of people can't tolerate it. So we have found that water-based lubricant, and especially for kids who you need to moisturize their nose here in Las Vegas where it's super, super dry, it actually works really, really well. But like I said, we'll provide you a label to cover up the other aspect because the lubrication is used for many different reasons. But the moisturization that it provides and the protection that it provides in reducing friction from intercourse and other things, it is amazing in terms of its benefits. This can be found on Amazon. That's primarily where our office buys it from. But this is my preference, definitely water-based if you're going to use lubricant, not glycerin-based. These are the vaginal dilators I was talking about. These are medical grade. These are silicone-based. Obviously, you see there are a lot more sizes than the one that I have. The reason I don't have this set is because these are kind of more expensive. So when we write prescriptions for these, we write for these type. These are silicone-based. They're very, very nice because they start out about the size of a pencil in diameter and they go up from there. Obviously, very few people have to get to level 8, but for those who are looking to go from 1 to 5, they are very useful. Or for younger girls who are terrified of having sex. And, you know, that's more common than I think people talk about, is girls who are terrified of having sex. Their first time should not be so traumatic, and it often is. They can use these to become more comfortable with the idea of having sexual intercourse later on. So it's completely up to the individual and their needs. We often use these more, like I said, in older individuals who have maybe not had sex in some time to retrain the muscles and retrain the body to accept certain sizes. On occasion, we do use Premarin cream. It is a conjugated estrogen. In any woman who's had a history of breast cancer, we don't use it, but we do use it in others to prevent tissue atrophy and drying out. Sometimes it works. If you have males with nosebleeds and they're severe, sometimes you can use it for that too. So we use it in the nose just to toughen up the tissue and kind of heal it. But those are pretty extreme cases. We usually don't have to get beyond Amicar, tranexamic acid nasal sprays for those. But if we need it, it is there. We prefer it topically. Obviously, there are some problems when it's systemically taken in a pill. But as that said, for women who have any kind of hormone therapy, we always want to take those benefits and risks into consideration because hormones are not as benign as they are made to sound. I know you can get them over the counter in a lot of places, but hormones do come with risks, mood swings, sometimes weight gain. Unfortunately, mood swings can be so severe that people want to, unfortunately, take their lives. That's something we have to consider as a huge risk. And that's one thing that I have brought up in a peer-to-peer where an insurance company did not want to approve factor therapy for a girl that I was treating, and they were having significant side effects in mood. And I explained to them that the risk of death was far higher because they had been considering suicidal ideation. And those things are not talked about enough. Most of the insurance companies just don't want to pay for factor. But when you are documenting these things, these are important risks that we don't see with factor. I've never given factor to anyone and had them have a side effect of wanting to be in a bad mood or have anything like that. And that happens with hormones. So things to keep in mind, the hormones are not necessarily as easy on our body as we wish that they would be. Again, we use vaginal douches at our clinic. We use Lystita and Amicar. We have a compounding pharmacy in our building who does them for us. So for some women who have conveyed too many episodes of bleeding with intercourse, we have them douche before and douche afterwards, usually heal up those tissues to try to get them on a better treatment regimen so they're not bleeding in between their period and kind of going down that line. And then, of course, packing. These are much more severe situations, but on occasion for a woman who has a laceration that is not healing, sometimes we will do this to try to get it healed up in a more timely manner. It really just depends on the individual woman and the need and the extent of the injury that we're trying to deal with. And with that, I will open it up for questions, comments, suggestions. I'm open to anything, any questions, input, anything at all. I'm just happy you guys had me out. I like giving this presentation and seeing everybody because I like seeing everyone in person much better. So I'll open it up to Janet to take questions.
Amber, we had one comment of somebody received information today about the fact that menstrual cycles are seeming to be worse post-COVID vaccine. Have you heard anything about that? Or that the COVID vaccine has changed?
I have heard that anecdotally. We haven't seen that at our clinic. And I would be honest that I wouldn't know the mechanism of what it would be, but the best that I could suggest is that having the COVID vaccine does put your body in terms of a stressful situation. So we have seen in other instances, such as traumatic car accidents and things, that after that, because of the stress that your body was under, it can cause your body's regular rhythms, regular cycles to be disrupted. And in the same vein, we haven't had vaccines in the past that were as effective in terms of this type of virus. Like the influenza vaccine is not very effective, but when you look at the Moderna and the Pfizer, this level of efficaciousness was actually unexpected, that we would get these high level of antibodies. But at the same time, when you are generating this level of antibody in someone, you're triggering the immune system, and the immune system can stress out the body. So you may feel unwell after you've gotten the vaccine. There is a very rare but possible potential for your immune system to be too triggered, and it can actually identify your platelets as being foreign and either take them out of the system. Those are very, very rare. But oftentimes when people have disruptions in their periods, it's because their body has been stressed enough, which disrupts their hypothalamus and the pituitary system. And when you disrupt that, you can disrupt the cycles. So is it completely possible? Yes. Do we understand the mechanisms of why that is occurring? No. Do we understand when that might resolve after getting the vaccine? We don't know that either. We do know that fertility does not appear to be affected by the vaccines. On the Pfizer study, many women who were directly involved with that, of course, they were not pregnant when they went on the clinical trial. They wouldn't have been allowed to be on the clinical trial, but they became pregnant while they were on the clinical trial. So they didn't see any issues there. They actually had one miscarriage, I believe, but only one, and it was in the placebo group. So that individual had not actually received the vaccine. So we don't anticipate it being a fertility issue. I can foresee that it may disrupt cycles for some time, but like I said, I do anticipate cycles being disrupted in any woman in any kind of stressful state. And so if you're using a vaccine to induce a stress response, immune response to develop antibodies, I can definitely foresee that happening. It would be wise always, if there is any alterations in your period, to get evaluated. So we would just take a look, make sure that the platelet counts are still fine, make sure that everything looks good. There is some unknowns, and I'm sure everyone has seen in the news, there's a rare risk of having a blood clot with the Johnson & Johnson vaccine. And a lot of that has to do with, again, the response to platelets and how it's acting in that capacity, causing a clot and then subsequent bleeding. The rates are less than if you were struck by lightning, but the risks are there. We don't recommend in our clinic the Johnson & Johnson vaccine for our patients, but we also have a mix of patients who also they already have known genetic risk factors, factor V Leiden, those kinds of genetic things that are already predisposing them to develop blood clots, or they're on high dose hormones already. If you take someone, I mean, you've seen on the news before, sue this birth control company because they got a blood clot or DVT. And the reason for that is you're taking people who have normal clotting activity. They don't have any deficiencies. They don't have hemophilia. They don't have von Willebrand. You're giving them hormones, and those levels of those clotting activities are going from normal to high normal all the time. And if you stay up there for long enough, your body will be like, what do I do with all this extra clotting factor? Well, let's go over here and make a clot with it. And that's what will happen is those women will get a DVT or they will get a pulmonary embolism. And so there is always some risk involved when you're changing anything of those possibilities. However, I will also note that if you do become infected with COVID-19, the risk of having a blood clot is significantly higher than from the vaccine. A lot of the people that I have treated here in Las Vegas with COVID-19 went on to have a pulmonary embolism, despite the fact that they have a bleeding disorder. And now we're trying to treat both sides, trying to keep them in the middle of the road because of the way COVID has affected their body and affected their immune system, and their immune system affecting their inflammation and everything. And we really never anticipated. This virus has been a little bit more unpredictable than we would have liked. But I'm hoping that answered that question. If that person could let me know, or if there was something confusing. I'm always honest with everybody. We definitely, I'll never say that we know anything for certain, but that would be my best educated guess as to why that might be occurring or why we may see that happening moving forward, because it is very curious that the people who are having issues with some of these things we're seeing are females between the ages of 18 and 48, whose hormone system is still very much in drive. And we are not seeing it in the older population whose hormone system is very much done. So it's going to be interesting how we look at that moving forward.
Definitely. Amber, there's a question in terms of how does oral Premarin affect bleeding levels?
So just like I described with the hormones that you might get in a pill form, what it's doing is it actually increases any kind of oral hormone you take will increase your factor 8. It will increase your factor 9. It will increase your von Willebrand. So in von Willebrand disorder, you have storage of von Willebrand in your vessel. And so this will push what's ever available and increase those levels in your bloodstream. So anytime you're given hormone, you will go from your normal level that you're making every day, because your body is always in preparation for you to bleed. It always thinks something bad is going to happen. So it's always ready. Unfortunately, for people with bleeding disorders, it's just not as ready as all bodies are. And so if you take that level that's already low and you give them hormones, it will bring them up to a normal level. That's why we don't see as many DVTs or blood clots when we give women with bleeding disorders hormones, because you're taking them from a lower level and you're bringing them up to a normal level where most other people are sitting every day, all day. But if you take a normal person who does normal levels and you increase that too high over time, that's a different problem. So that's why hormones actually stop your bleeding and help you with bleeding. And the reason we use them indirectly to help people with their periods is not just with the uterine lining, but it's also with the activity levels. It's a way to increase the activity levels that doesn't involve an infusion. It doesn't involve a nasal spray with side effects. The problem that comes with it is it does raise your risk for certain other things and decrease your risks for other things. And so it's a really conversation about what are the benefits, what do I need it for, versus what are the potential risks. But the reason it's helping you with your bleeding disorder is because it is increasing those clotting factors in your blood.
Thank you, Amber. And again, kind of on factor 8 levels, does the vaccine raise factor 8 levels?
So we don't know that as of right now. My educated guess would be that it does. And the reason I believe that in terms of mild patients is, as you know, a woman who has mild deficiency on either hemophilia B or hemophilia A, if you, more so in hemophilia A, excuse me, if you stress them out, you can push any available clotting factor that they have available, and inflammation and everything will actually increase those levels on its own. So if you have the COVID vaccine, right after you have the vaccine, you're going to have very high levels of inflammation induced by your immune system for at least the next couple of days. So you're going to feel like you have kind of a viral syndrome, which is going to increase all your inflammation. Might make your joints hurt because of that amount of inflammation. But yes, your levels of factor VIII will also rise with that inflammation. And unfortunately, that kind of inflammation and that inability to get accurate test results in the setting of inflammation has actually caused a lot of people to be undiagnosed from their bleeding disorder. So a lot of people who were diagnosed and finally they got 20%, years later they developed an autoimmune condition that caused a lot of inflammation. It can actually overlap that. And things as simple as walking up the stairs, exercise can increase your clotting factor proteins. In third world countries, if you have patients exercise the part of the body that is not injured, you can increase that clotting factor access in other indirect ways to help them with their injuries. I mean, it's absurd in the United States we would ever say, hey, you have an elbow bleed, you should go running for a little bit. But sometimes when you don't have access to anything in another country, you can do a stress-induced response, and your body is very smart. It's connected in that fight or flight response. So anytime your body thinks, oh my God, I'm going to have to start bleeding, it will actually dump everything that it has available into your body, which is also one of the reasons I think that we are seeing some of the blood clots in certain individuals is the level of inflammation that is occurring in that couple of days to weeks after is increasing their levels too high for too long. And then they're having an immune response to platelets. So that's kind of what we're seeing in that setting.
Still so much we don't know. Another question for it's from a Hemophilia B carrier who's premenopausal, experiencing heavy bleeding episodes such as bleeding heavy clots for 2 straight weeks. Do you have a recommendation?
The first thing I would want to start with is kind of a log of what was going on when it first started. Was there any stress? Was there any sexual activity? Was there anything that would suggest that there would be an increase in bleeding? And then additionally, now that it's been 2 weeks, whomever the gynecologist is needs to look at where their hormone levels are, follicle stimulating hormone, those avenues, so they can kind of see where they are in their cycle, so they can better recommend avenues to stop the bleeding. But we would also recommend a pelvic exam because, like I said, sometimes bleeding we think comes from the uterus isn't coming from the uterus. Sometimes it's coming from the vaginal canal or it's coming from the cervix. So we want to be able to visualize and see where that bleeding is coming from. And then if we don't use hormones, I'm more inclined to use factor straight off in that situation, because even in the absence of being able to do a pelvic exam, if you give factor and the bleeding stops, you're able to know, hey, that area was able to heal up. We were able to heal it up long enough, because women, especially who are lower levels of factor, their healing times are prolonged. So what should take 2 days for one person to heal could take a week or 2 weeks for someone who has lower levels to heal. So unless you give them what normal individuals have available to heal their body, you may not be able to get them healed in that time frame. But yeah, our site is probably more aggressive in terms of using factor therapy. We don't like the terms at our center. We found too many emergency physicians would get confused with the term carrier, and they would assume that it means that they don't have to worry about it. And so we don't use it. We actually, our bans and things, they'll actually say factor VIII deficiency, factor IX deficiency, because it also gets away from the stigma of you can't have hemophilia because you're a female. And so we found that if the ER physicians saw on their bracelet they're deficient in something, they're like, oh my God, they have a deficiency, I should call the hematologist, instead of seeing, oh my God, it's hemophilia. Oh, don't worry about it. That's definitely not causing their bleeding. So I would start with seeing if the hematologist would consider doing an infusion to see if it can help stop the bleeding, or even start antifibrinolytic therapy to see if it lessens it up in those avenues. But it can be kind of hard without knowing the individual aspects.
Right. We have a share from LadyBugs Barbie. Barb, can you unmute?
Mute. I keep going to unmute and it's not doing anything. Can you hear me?
Yes.
Yeah.
I'm sorry. I'm going to try very hard to be succinct with this. I recently had some serious health issues regarding my first administration of the COVID vaccine, and so it's slowed me down a little bit. My heart is still in this, but my brain might not be working as fast as I want it to. But what I want to say first and foremost is, Amber, bravo. You have put on a kind of a presentation that I'm 69. I needed this 50 years ago. Okay. Thank you from the bottom of my heart. And I think I'm speaking for a lot of people out here who are the ladybugs who, needed to hear this. Some of them have heard you speak before, etc. But most importantly, I want to say to Chess, Janet, and Eric, and everybody involved with Chess, I could not be more proud of this moment that I needed 50 years ago. Okay. But let me just point out two things. One is that today I was the one that posted a website, my first hemophilia treatment center social worker, knowing what happened to me post my vaccine, sent a link to me, which I did post on the chat room. For anyone who's involved in wanting to know, I'm not trying to scare anybody, but I am telling you there is something going on with the way the platelets react with this vaccine. That's documented, and it's actually documented in this particular website. I don't want to go into it. I don't have a medical background. It's just food for thought. The second thing, and I do want to address this from an animal lover aspect. So Premarin is actually a great medication for many people. I don't want to down it. I do know that the way that Premarin, pregnant mare urine, is obtained in order to get the enough of the concentrate that's needed to make the Premarin is, and again, I'm going to be very controversial here, it's a very inhumane way. I've been an animal lover from way back, and the horses are mares are put into very tight stalls where they are given salt to make them thirsty, and then they refuse them water. And then what happens, and this is all documented, you can look it up, the horses are so thirsty that when they finally drink, they produce this very concentrated mare urine that goes into the production of Premarin. And listen, I know nothing about the way other things are manufactured that I take that are probably as awful or whatever, but I personally chose, as a horse owner and lover, not to use that product at that time because of the inhumane way that the estrogen is obtained from the animals. And again, I'm putting this out there as very controversial. I don't have any letters after my name, just animal lover, AL. And just wanted to throw that out if anybody is thinking that maybe they want to use an alternative. That's what I decided to do when the time came. And that's all I want to say, other than, Amber, you are rocking it. You are totally rocking it. That's all. And so is Jess. Bye-bye.
Thanks, Barbie. Any other questions, thoughts? You guys have all been so amazingly attentive and such a great conversation this evening. truly appreciate it. And Amber, all of the information that it's just kind of interesting watching, kind of the chat to say, no one ever told me this in my high school health class. And like Barbie said, I wished I'd known this 50 years ago. There's information that, some people have said, I've seen your presentation 4 times and I still learned something new. So I can't thank you enough. Please remember that there will be an evaluation for this that will be sent to you via email. We will send a recording of this presentation, and we're really hoping that when we can do a live program that maybe Amber will be able to join us. So with that, Eric has put the link to SurveyMonkey for the evaluation. And I thank you so much for your attendance, for your interest. And Amber, thank you so much from the bottom of our LadyBugs heart.
Thank you for having me, guys.
Have a great night, everybody.
You too.
Thank you.